This podcast is brought to you by the North Dakota Petroleum Foundation. From heating our homes and powering our vehicles to cell phones, clothing, and medical equipment, oil and natural gas makes everyday life better. North Dakota Oil and Natural Gas, advancing the possibilities. Learn more at ndpetroleumfoundation.org. Welcome to Plain Talk Live. I'm Rob Port, and I got to tell you, not feeling super good right now because just hours ago, and I didn't plan it like this, but just hours ago, I got my second shot of the Moderna vaccine. Why Moderna? Well, that was the one that was available when I signed up. And I asked my doctor, and he said Pfizer, Moderna, whatever you can get. But that was a decision I made for myself, was to get vaccinated. I talked about it with my doctor because I'll be honest, I had a few concerns. This was something that was developed very quickly, and I also had a very, very serious bout with COVID-19 back in December, which I wrote about, which a lot of you know about. It was a touch and go thing for me. It was very scary. And I didn't know. I didn't know what that meant. Somebody who had it as bad as I did, does that mean I should get vaccinated? I didn't know. So the place I went to for information was my doctor, because more than Facebook or some talking head on the television, my doctor knows my health better than anyone. So when I had that question, I had an appointment with him, I talked about it, and he said, you should get it. And I did. But there's a lot of things going on in the world right now. North Dakota has one of the highest rates of vaccine hesitancy in the nation. There's also, right now, one of the major vaccines that have been released, the Johnson & Johnson vaccine, has been paused because there were concerns about clotting. On the global scale, the AstraZeneca vaccine was also paused for a while in Europe over the same concerns about blood clotting. So in the vein of wanting to just get as much good information out in front of people to help them make their decisions as possible, I wanted to bring on Molly Howell, who is the director of the manager, I think, of the vaccine program for the North Dakota Department of Health. I probably just completely mangled your job title, Molly. I apologize for that. But certainly thank you for coming on, and thanks for the time. Hello. I think we may be having some troubles with your mic right now, Molly, because you're super staticky to me. Try talking again. Yeah, for some reason, all of a sudden your mic's not working the way it was when we were testing. So I'm not sure what's going on with that. Don't worry about it. We'll get it.
Is this better?
That is much better. That is perfect. I can hear you now. All right, no problem at all. So, Molly, thank you for your time and being on the show and talking about vaccines, which I imagine takes up, well, it's your job. It's like me.
That's right. Vaccines is my job. So.
It's like me talking about politicians. So tell us, the Johnson & Johnson vaccine, what does that mean for the state of North Dakota? First of all, how many actual people have gotten the vaccine, the Johnson & Johnson vaccine in our state?
Yeah, so far in North Dakota, 21,304 people have received the Johnson & Johnson vaccine in North Dakota. So that represents a small percent of doses administered. About 5% of doses administered in the state have been the Johnson & Johnson vaccine. This week, we were only slated to receive 1,400 doses of the Johnson & Johnson vaccine. In comparison, we're receiving over 20,000 first doses of Moderna and Pfizer, so it is a small percent of the COVID vaccine doses that we receive.
Do you, when the news came down that Johnson & Johnson was being paused, what did that like as a practical matter for the state of North Dakota in terms of obviously getting the message out? It's, for instance, somebody who had an appointment to get the Johnson & Johnson vaccine, what did that mean for them? Did they need to cancel their appointment, or how did that work?
Well, the first thing we wanted to do is make sure healthcare providers and our providers who are giving COVID-19 vaccine were aware that they should be pausing administration of the Johnson & Johnson vaccine. So the first thing we did right away in the morning was notify providers that they should not administer any Johnson and Johnson vaccine and notify patients of that. And so that did happen, and we actually are able to monitor real time using the North Dakota Immunization Information System to make sure no providers were giving Johnson and Johnson vaccine that day. And then we wanted to put out messaging for the public as well. And so that's why we did a news release and held a media briefing to notify the public of the pause in the Johnson and Johnson vaccine. But also we knew some of the public who had been vaccinated recently with the J&J vaccine might be concerned about their health and wanted to inform them of what to look for and when to contact a healthcare provider if they were concerned.
So for people who may be watching this or listening to this, who got the Johnson and Johnson, I mean, what should they be? I mean, first and foremost, if you have concerns, you obviously contact your doctor, contact your medical professionals. But I mean, just as somebody who's sitting at home, I got this vaccine. What do I need to be thinking of? What are those symptoms or what are those signs?
Yeah, for people, it's been more than 3 weeks since you've received a dose of Johnson and Johnson vaccine. You really don't need to be concerned, as the concern is blood clots in combination with low platelets. That's occurring 6 to 13 days after vaccination, on average about 8 days after a vaccination. And so really we're looking more at people who have been vaccinated in the past couple of weeks with the Johnson and Johnson vaccine. They need to be looking for severe headaches, severe abdominal pain, leg pain, and shortness of breath. And if they're experiencing any of those symptoms, they should contact their healthcare provider and let them know of their symptoms, and also let them know that they received the Johnson and Johnson vaccine.
So obviously one thing that we're, and I'm sure you've seen the same survey numbers and from multiple services that sources, that North Dakota is a place where there's a lot of people who are pretty skeptical of the vaccine. Is it safe to say, I've been watching the numbers daily on the Department of Health's dashboard, and it seems like our rate of vaccination has been slowing up a little bit. Is that fair?
I think it's fair to say our rate of vaccination is not increasing at the rate it previously was.
Right.
Although last week, when we look at total doses administered, we administered more dose, or it was the second highest week we've had for doses administered since COVID vaccine became available. So it's kind of hard to say, because last week we did have a pretty good week of vaccine administration. But I do, in talking with healthcare providers, and also we have a hotline, and seeing a reduction in the calls of people looking for vaccine, I think we are seeing a slowdown in vaccine administration.
So, from your perspective, does that mean it's time to switch? Because obviously, we're getting shots in the arms of people who are convinced this is right for me. I want to do this. I've made the appointment. I got the shots. We're running out of those people. Now we're coming up with the people, and let's be honest. There's a small portion of the society of our society that is just very, very against vaccination. They're out there. They have that opinion. That is what it is. I think there's a lot more people who are hesitant, who are but persuadable, right? And I don't want to be dismissive of their hesitancy, because again, it was a pretty unusual process that led us to these vaccines being obviously an exigent circumstance on the global scale. I mean, it was an emergent situation. Yeah, we hurried some things up, cut some of the red tape. So I can understand why people were saying, hey, boy, this was really rushed. I'm a little hesitant about that. What do you say to those people, especially in the context where we have the Johnson and Johnson vaccine was paused? I mean, a lot of people, I think that makes them think in their heads, gosh, my hesitancy is correct.
Well, I'm hoping, one, that the situation with the Johnson and Johnson vaccine lets people know that the US safety surveillance system for vaccines is robust and strong, and also transparent. And so they were able to identify a very rare potential vaccine adverse event that occurs in one per more than 1 million people vaccinated. And then they came out with information as soon as it was identified. And so if anything, I hope people feel more confident in the Pfizer and Moderna vaccines, knowing that over 180 million doses have been administered and no concerning safety signals have been identified. other than the severe allergic reactions we've talked about previously, which can be treated and are manageable and are also extremely rare. And so I'm hoping that gives the American public more confidence in our vaccine safety system. But I also understand is a lot of hesitancy. The vaccine is available sooner than traditional vaccines. And I think we need to do a better job of describing one, that these vaccines were already in development. It's not like they started from scratch last January when COVID disease became a thing. These were vaccines that were already in development for other diseases or for other coronaviruses. The federal government put all of their efforts towards making them available, including funding, manufacturing, distribution, and then the FDA still required large clinical trials, 2 months post vaccination safety data, and they wanted to see at least a 50% efficacy rate before vaccines were authorized for use in the United States. And now for Moderna and Pfizer, we have 6 months of data, which is what we normally have for clinical trials on their effectiveness and safety. And so I'm hoping people are starting to feel more confident as they see other people getting vaccinated, and they see that we're not having the deaths and hospitalizations we were having before because we have a high vaccination rate in our 65 and older population.
One thing to point, because you said, obviously a lot of people, I mean, millions and millions and millions of people have been getting the other vaccines in the United States of America. That's Pfizer and Moderna. Um, and we really haven't had any problems. But even if we're talking about the Johnson and Johnson vaccine, even there, we're talking about I'm forgetting what the number is. It's a very low. Was it like 8 people that developed?
Six people,
Six
six.
people. Okay, that's
Mhm.
what it is. 6 people who developed clotting issues out of how many million?
Almost, yep, almost 7 million Johnson and Johnson doses administered. And so it's a very rare adverse event. And you have to weigh your risk of an adverse event from the vaccine with an adverse event that you could potentially have from getting COVID. And right now in the United States, 700 people are dying every day due to COVID-19. And so um, that's why it's such a struggle that they did put a lot of people don't even think the J&J vaccine should be paused because it is such a rare adverse event and so many people are dying from COVID. And so I think that's the other issue is I don't think people understand the true risk of COVID disease that they have.
I've seen a lot of people making the comparison that they'll say like birth control. I guess some forms of birth control. This is one comparison that I've seen. And again, if you want medical advice, please don't come to your humble columnist. Please talk to your doctor. But one thing I've seen out there is that birth control, like 1 in 1,000 or 1 in 2,000, there's a risk of clotting, and obviously millions and millions of women use birth control every month or every day, and we don't seem to have a problem there. So here we have 6 out of several million. That's obviously a much lower percentage. Why was it? I mean, maybe that's not wasn't your decision to make, but that does seem, especially at a time when we're dealing with a lot of vaccine hesitancy, that seems like maybe too cautious a move.
Well, I don't make that decision. You're right, and it is a difficult decision. And yesterday, the advisory committee on immunization practices had the opportunity to decide whether or not we should start using the J&J vaccine again, or if they should make recommendations around the J&J vaccine. And they decided to continue with the pause until there's more information available. I think they're having trouble understanding. One, I think they want to see if there's more cases, and so they want to know the true rate of which this occurs in vaccinated individuals. And then I think they're trying to determine maybe there's certain people that shouldn't receive J&J. Maybe women shouldn't receive J&J, or maybe people under the age of 50 shouldn't receive J&J. And so they're trying to make that decision. But I do think in the US, where we have two other vaccines, it is a little bit more difficult. People are probably not going to accept the J&J vaccine when there are two other vaccines that have a proven safety record.
How does when because obviously this is a fluid situation in some ways, and there's a lot of information, and we're still learning a lot about COVID-19 and the vaccination. We're still learning. We're still learning a lot. Um, Can you explain how does that information flow work from, like, for instance, like the federal government or the researchers down to the doctor? Because I'm telling everybody, talk to your doctor, right? Don't listen to Facebook. Don't listen to cable news. Don't even listen to me or anybody. Certainly don't listen to me because I don't have any medical training at all. Talk to your doctor, right? But how do our doctors, like, how are they kept up to speed on this information? Is there like an email list or something? How does that work?
Yeah, I think there's a number of different avenues. The Department of Health does have an email listserv where we keep physicians and other practitioners updated regarding COVID-19 vaccine. We work very closely with the North Dakota State University Center for Immunization Research and Education, which has played a critical role in educating providers across the state about COVID-19 vaccines. And then I think many providers also read a lot of journal. I mean, they are always learning more in medicine. And so they also have different associations like the Medical Association, American Academy of Pediatrics. They're going and reading the FDA briefing documents. They're looking at research published in peer-reviewed medical journals to understand the vaccines and the risks and the benefits.
So speaking to vaccine hesitancy specifically, a lot of the things I've seen when I've written about my experience with the vaccine, I've posted about it on social media, I talk with friends and family, and I just want to run you through some of the rebuttals, I guess, or the comments that I get back. Um, for instance, one is that in my particular case, I get asked all the time, you already had COVID, right? You had a very bad. Don't you already have immunity? Why did you need to get vaccinated if you already had it and you're already immune?
Yeah, and I think that's an understandable question. And the answer is likely you did have some immunity after you had COVID, but we don't know how long your immunity will last after having COVID disease or COVID illness. And so people can wait 90 days after their infection if they want before they're vaccinated. But really, beyond that, it's still unclear because we are still learning more and more about COVID, how long immunity will last. And we don't want people to be walking around unprotected and think that they have protection from COVID because they had it previously, because there has been some cases of reinfection. But I do think that's a fair question, and I do think it's realistic for people to wait 90 days after they had COVID to get vaccinated.
Another response I hear is because you and I have both been saying we're still learning a lot about this process. So people have suggested that the people getting vaccinated are lab rats, so they're being experimented on because we don't really know what the long-term implications of these vaccines are. What would you say to those people who have that concern?
Well, I would say the clinical trials for the COVID-19 vaccines were as large, if not larger, than vaccines that we routinely use in the United States every day. We still required there to be a certain efficacy, which these vaccines have shown to have 90-95% efficacy for the Pfizer and Moderna vaccines. We've also shown safety data. Initially, when they were authorized, we had 2 months post-vaccination safety data. And for other vaccines, adverse events occur within 6 weeks of vaccination. When you're vaccinated, your immune system responds right away. There's no reason to believe that a vaccine is going to cause an adverse event, months to years down the road. Adverse events happen right after vaccination. And the thing I think people don't understand about the mRNA vaccines, the mRNA doesn't stay in your body. It's delivering a message to your body as to how to develop antibodies to COVID-19. And then the mRNA and the vaccine is gone. It's no longer in your body within days. And so there's nothing there that's staying in your body to cause any sort of adverse event or reaction months to years later.
Another thing I've heard from somebody is because they asked me which one I got, and I said Moderna, and they said, "Oh, okay, you're good to get Moderna, but the other vaccines have fetal tissue in it, which people who have maybe a pro-life political view or whatever have an objection to that." I hadn't heard that before somebody mentioned it to me the other day, but since I've seen it in a couple of reports or a couple of social media posts, what about that?
First of all, there are no fetal cells in any vaccines, and so I want to take that myth away. I will say sometimes vaccines do use a fetal cell line in the development process. Neither the Pfizer or the Moderna vaccines did. They are considered ethically uncontroversial according to medical ethicists and Catholic organizations. The Johnson and Johnson vaccine did use a fetal cell line from the early 80s to develop its vaccine, but that's so for how it grows the virus for the vaccine. There's no fetal cells actually in the vaccine. You're not being injected with fetal cells.
What does that mean to use a fetal cell line?
So it was the Johnson and Johnson vaccine in particular used a fetal cell line from an aborted fetus from the early 80s. It was not aborted for the sole purpose of producing the Johnson and Johnson vaccine, but it's a fetal cell line that they use for a number of products. And viruses don't grow like bacteria, like on a petri dish. They need to grow in a cell, and so that's why they needed to use a fetal cell line for that development.
So as what are North Dakota's strategies as we come up, because we're going to come up on a point where again, early on it was trying to find a vaccine appointment. I mean, when my category that and I'm forgetting what one A. By the way, I the 1A 1C thing, like, could we just do like 1 2 3 4 5? Like, did we need all the subcategories? Anyway, old man rant over. I got confused. When my category came up, like, the big thing was trying to find an appointment. I couldn't find one necessarily right away. Now it seems like it's at least in my experience, as I see other members of my family get vaccinated, it seems like it's no problem getting one for the most part. Like, they're generally just pretty much available. Um, but yet we're still at, where are we at now? Is it like 40% fully vaccinated in the state? I'm forgetting the last number.
We're almost at 50%
Almost at
having
50.
at
Okay.
least one dose.
Okay.
Yeah.
So how are we going to get that next, 40, 50% of people to get a shot in their arm? What's the state strategy for persuading those people or getting the message to those people?
I think right now we're trying to make the vaccine more convenient. And so, yeah, I think a lot of people struggled getting appointments early on. And so we're trying to do more walk ins. We've started doing pop up clinics at community events or different stores like Walmart. If you go to Walmart, there might be a vaccination that happens to be there for you. So, really, going to workplaces, offering vaccination where people are working. We're going to universities to offer vaccinations right on campus. And so I think our first strategy is really making vaccine more convenient, because I think there are some people who aren't even hesitant. They're just more passive and they're not going to actively go out and seek vaccination or make an appointment.
But if you make it easy
Uh,
for them.
yeah, just make it easy for them, then they're willing to take the vaccine. And then I think our next strategy is we have to really address vaccine hesitancy head on. And it really is varying by individual or by different groups as to what the hesitancy is. I think the number one thing we want is for people to have a conversation with their healthcare provider about COVID-19 vaccine. Pick up the phone, call your healthcare provider. The vast majority of physicians have accepted COVID-19 vaccine when it was offered to them. And so if your doctor is accepting the vaccine, then you should probably really consider the vaccine as well. And so we really want that to start happening. And then also working with other trusted community leaders. I think we're seeing a little bit of some people are getting the vaccine because they know others got the vaccine. And so if you're in an area of the state where you don't know anybody who got the vaccine or no one's admitting to getting the vaccine, it's a little bit more difficult for you to raise your hand and say, yeah, I want to get vaccinated.
It surprised you how political a lot of the vaccination stuff got, and really, I guess vaccines were kind of political even before all of this. But it surprised me a little bit that there was, and I guess the surprise came when again I posted, I got my shot on social media, and people are like, oh, what are you sharing that for? Who cares? Like, wow. I didn't realize it was so controversial. Why do you think that is? What drives that?
Well, I've been in immunizations since 2003, and really the interesting thing about immunizations is it's never really been political. I think there's people on both sides that have been supportive of vaccines, and then I think there's people on both sides, a very small percent, that have been hesitant or wanted to exempt from vaccines. And I've really never seen a political issue there in terms of vaccine hesitancy. I am surprised that this vaccine has become so politicized because it shouldn't matter what your political affiliation is when it comes to medicine or health. I
Yeah.
mean, this is a vaccine.
Biology doesn't have a partisan affiliation.
No, it doesn't know if you're a Republican or a Democrat. It's going to affect us all the same way. And so I really want people to talk to their doctors about vaccination and really have that honest conversation and be really cautious about what you're seeing on social media, or in the news media. And if you don't even have to trust me, don't trust me if you don't want.
Yeah.
Talk to your healthcare provider about vaccination and specifically say what your concerns are and get your questions answered.
Your healthcare provider, who, as you mentioned, probably got the vaccination.
Correct. Yeah.
They probably, talk to them about it. I mean, nobody knows more about your specific health situation outside of yourself than your doctor. And your doctor has a medical degree, which you probably do not. So, that's who you should talk to. And the idea that your doctor in Dickinson, North Dakota, or Watford City or something is in on some conspiracy is a little silly. Where can people go if they want to try to find a place to get a vaccination? Do the Department of Health have some tools like that available?
Yeah, we have a COVID vaccine finder on our website. You can put in your zip code and it'll pop up all the vaccination clinics that are available in your area. And as I said, we're trying to make it really convenient. Vaccines now available at local public health, your private provider office, pharmacies. We're also really trying to get out into the community and do more events in the community. And if anyone is struggling with getting access to a vaccine, they can call the North Dakota Department of Health hotline and press line 2, and we will find a vaccine for you. Even if you're homebound, we will find someone that can come to your home that will vaccinate you if you're interested in a vaccine.
And right now it's everyone 16 plus.
Everyone 16 plus has access to vaccine. That's correct. It's looking like children 12 to 15 may be added sometime this summer. So that's the other thing. If parents are seeing their kids' pediatricians right now and getting ready for back to school next year, start that conversation. If you have concerns about COVID vaccine for your child, start having that conversation with your child's pediatrician.
Yeah, that's interesting. Do you think? I mean, is that gonna? I mean, a lot of times when I have a 5-year-old, we're going to be sending to school this fall, and of course, part of that process means making sure he's got all his shots. I mean, is there anything in terms of schools, and maybe that's a school district level position, but is that going to be something? Because normally you have to turn in a vaccination record or whatever. I mean, is that going to be is COVID going to be part of that?
No, COVID-19 won't be required for school entry, and that would require legislation. So we'd have to go through our legislature if we wanted to add a vaccine to school requirements.
And then how young do you think it's going to go on kids in terms of COVID? I think you mentioned going down as low as 8 by the summer. I mean, is there going to be a point where I mean, how young would this go? I guess.
I think this summer it'll probably be down to age 12.
Oh,
And
okay,
then
12.
early next year, it could even be as young as infants, 2 months of age,
Infants. Wow.
potentially.
Okay.
Hmm.
Okay. Well, that's interesting stuff. Well, that's great. Great information, Molly. Thank you so much for being on. I appreciate it. And again, if you're curious about the vaccine or you want to know more about it or you just don't know what's for you, heck, you don't even have to remember anything we just told you. Just talk to your doctor. They're the best person to talk to. Molly, thanks for your time.
Thanks.